Welcome, everybody, to this Beyond Pesticides Forum. I am Paula Dinnerstein. I am the president of the board of directors of Beyond Pesticides, and it's my pleasure to welcome you today to the second in our series of the 41st National Forum of Beyond Pesticides, entitled Imperatives for a Sustainable Future, Reversing the Existential Crises of Pesticide-Induced Illness, Biodiversity Collapse, and the Climate Emergency. Our speaker today for the main portion of this webinar is Dr. Tracy Woodruff. She is a professor and a director of the program on reproductive health and the environment at the University of California at San Francisco. And her talk will focus on the public health harms of petrochemical chemicals exposure and particularly endocrine disruption. After her talk, there will be a question and answer period, and you'll get some instructions as to how you can participate in that. And then we invite you to stay on for the second hour, which will be a roundtable discussion called Empowering Advocacy for Change with Science. And we will have leading experts in the fields of regulation of endocrine disruptors, scientists, and activists in the field of farm worker advocacy. Now I'm going to turn this over to Jay Feldman, the Executive Director of Beyond Pesticides. Thank you.
Thank you, Paula. Welcome again to the 41st National Forum. As Paula mentioned, this year we've entitled the meeting Imperatives for a Sustainable Future. The two major goals we've identified this year is one, increased public understanding of the threats to human health and ecosystems and the dire consequences of inaction or measures that fall short, and two, urgent action to eliminate societal reliance on petrochemical-based materials in food production and land management, from farms to homes, gardens, parks, playing fields, and schools. Please see the recording of the October forum session on viability, productivity, and profitability of organic practices and products. Today's session explores chemical pollution with links to endocrine disruptors. The common denominator in synthetic toxic chemicals are fossil fuel-based feedstocks, oil, gas, and coal, at the root of the existential health, biodiversity, and climate crises. French researcher and professor Dr. Barbara Deminiks points out in her article, How Fossil Fuel-Derived Pesticides and Plastics Harm Health, Biodiversity, and Climate, that Rachel Carson, now over 60 years ago, showed that the decline in bird and fish populations was due to DDT. That was 30 years before research showed that DDT acted through endocrine mechanisms. Oil is used to make chlorobenzene, which in turn is used to synthesize DDT. Similarly, according to Dr. Deminiks, many pesticides such as neonicotinoids, pyrethroids, and glyphosate are produced from gas and oil. Plastics, PFAS, and more are part of this list. Our keynote speaker today, Dr. Tracy Woodruff, who earlier this year wrote the article, Health Effects of Fossil Fuel-Derived Endocrine Disruptors in the New England Journal of Medicine, told us, quote, many of these fossil fuel-based chemicals are endocrine disruptors, meaning they interfere with hormonal systems and they are part of the disturbing rise in disease. The extraction of oil and gas and their use in production of precursor chemicals used in the manufacturing of synthetic pesticides and fertilizers are one of the biggest contributors to chemical pollution and the greenhouse gases carbon dioxide, nitrous oxide, and methane. The manufacture of petrochemical fertilizers and pesticides also creates a major environmental injustice for predominantly Black and Brown communities where production facilities are often located, and in land management where farm workers and landscapers experience disproportionate harm. 10 years after the publication of Silent Spring in 1972, the Great Lakes Water Quality Agreement between Canada and the US yielded a report on wildlife and human endocrine anomalies and reproductive impairment, with wildlife suffering elevated losses and disturbing reports of behavioral and intelligence problems in infants and children of otherwise healthy mothers who ate fish from the lakes. Nearly 20 years later, Dr. Theo Coburn co-convened the Wingspread Conference on Endocrine Disruptors and then co-wrote the acclaimed book, Our Stolen Future, in 1996, explaining endocrine disrupting chemicals as interfering with hormonal messages involved in the control of growth and development, especially in the fetus. That same year, Congress passed the Food Quality Protection Act, mandating that the U.S. Environmental Protection Agency regulate pesticides for endocrine disruption, but it resulted in abysmal progress. The range of endocrine disrupting effects are truly existential, from reproductive impairment and loss of fertility to breast cancer, testicular and prostate cancer, and a range of other adverse and multi-generational effects. Eliminating petrochemical products, including pesticides and fertilizers, is now a necessity, not a luxury. A cross-collaborative societal embrace of organic food production, land management, and consumer products is essential to sustain life. Now, a few words about our keynote speaker today, Dr. Tracy Woodruff. Dr. Woodruff is a professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences, and the director of the Program on Reproductive Health and Environment and the Earth Center in the School of Medicine at the University of California, San Francisco. Dr. Woodruff's work focuses on uncovering and addressing environmental determinants of disease and health inequities, and has written groundbreaking material on endocrine disruptive chemicals. Dr. Woodruff studies the harmful effects of chemicals and pollutants on health, pregnancy, and child development. She leads efforts to translate scientific information into actionable change in the clinic environment and through public policy. Previously, she has served as a senior scientist and policy advisor for the EPA's Office of Policy. She has authored numerous scientific publications and book chapters, has been quoted widely in the press, and has even taken on the chemical industry in congressional testimony. She has served on California's Scientific Advisory Board of the Development and Reproductive Toxicant Identification Committee and as an editor of the National Institute of Environmental Health Sciences journal, Environmental Health Perspectives. Dr. Woodruff holds a PhD from UC Berkeley and San Francisco in bioengineering and a master's in public health from Berkeley in environmental health sciences. Please use the Q&A function at the bottom of your screen to submit questions for Dr. Woodruff. Welcome, Dr. Woodruff.
Hello, and thank you. And you gave excellent introduction to the topics I will be discussing today. I'll just be putting really a much finer point on what you've already discussed in terms of fossil fuels and how that is used to drive the production of petrochemicals to which we are all exposed. So I want to first say that I have no financial conflicts of interest to declare. As Jay said, I am the director of the Earth Center and the Program on Reproductive Health and the Environment. Our work is very focused on creating healthier environments by stopping harmful exposures to toxic chemicals. Next slide, please. And just to give a reference, I'm going to be speaking from this article that I was invited to publish for the New England Journal of Medicine on health effects of fossil fuel derived, I swear the slides went away again, fossil fuel derived petrochemicals. And I want to say that this article is really a great summary of all the information that is, that consolidates a lot of work that's been going on over the last 30 years that I've been working in the field. And also I will highlight some of the key components about how it's not that we don't have enough science. It's really about what is going on in the process in terms of using the science to ensure that people are not exposed to these toxic chemicals. Next slide, please. So part of this is I want to just emphasize that we are seeing an increase in chronic health conditions among our population, and children are, I think, an excellent indicator of what is going on in terms of the increase in the number of different types of adverse health consequences during childhood, whether it's increases in childhood cancer, increases in neurodevelopmental outcomes, or widespread respiratory health outcomes. Can you hit the slide again? But this is also being concurrent with other effects that we're seeing ecologically. So I think and I think Jay pointed this out already, it's really important to understand these health effects in the context of what's going on ecologically, because we're also humans, just like the other animals on the planet. Can you hit the slide again? And not only has there been reports of insect decline, but also many different types of vanishing species in wildlife. And this is just another article from Science about the decline in bird populations. Next slide, please. So this is work that we have been recently doing at UCSF to really explain that a lot of the increase that we're seeing in chronic health conditions comes from industrial produced factors: fossil fuel, plastics, tobacco, toxic chemicals, ultra processed foods, and alcohol. Really, these are industrial epidemics, modern industrial epidemics that we're seeing in the population. So we've seen increases over the last 30 years in many different types of chronic health conditions, whether it's asthma, diabetes, cancers, Parkinson's, Alzheimer's, etc. A lot of them are from these risk factors. And one of the ones I will be focusing on for the rest of the presentation is fossil fuels and their contribution to toxic chemicals, endocrine disrupting chemicals, and pesticides. Next slide. And before I move on, I want to also note that this is a really unusual point in time. I think you heard that I used to work at U.S. Environmental Protection Agency. One of your panel speakers also used to work there. And what we've seen since just the 1990s is that in the 1990s, communicable diseases, those are things like typhoid, cholera, etc., malaria, were the primary contributor to the global burden of disease. And that has shifted over the last 20 years. So now non-communicable diseases, so cancer, respiratory diseases, cardiovascular, neurological, metabolic disease, are now the highest contributor to the global burden of disease at 64%. This is a dramatic change in the composition of the global pattern of disease, meaning that we must look at these risk factors that have been increasing in the population that are not genetic, that are external. And that is why we think that the focus on fossil fuel petrochemicals and other types of industrial produced products is so important. Next slide. So at the same time, we've seen a concurrent increase in fossil fuel consumption, whether it's gas, oil, and coal. Now, certainly in the United States, that coal has decreased in production, but we've seen that replaced with the dramatic increase in fracking, which has started pretty much around the year 2010 and is projected to continue to increase over the next several decades. Next slide. And I think this it's a little bit older study. It's from 2005, but I really like it because it is not new data that shows that we've seen this increasing in chemical and petrochemical production. But there's also this data showing there's also an increase in global pesticide production, fertilizer production, alongside also the increasing chemical industry production at a greater rate than we're seeing increasing levels of CO2, which everyone knows CO2 contributes to global climate change. So what is the role of these other chemical production components at the tailpipe? And I guess you would say a fossil fuel production is greater, that is going to have a much greater impact on the planet. And indeed, there has been some work talking about the planetary boundaries. These are boundaries by which, if they're crossed, they put the ecological systems on the planet, whether it's biodiversity and human health, at extreme risk of collapse. So you can see from this first article here on the right that was originally published in 2009 that the planetary boundaries include climate change, ocean acidification, etc., and these chemical pollution, which was not yet quantified. And of course, we've crossed the planetary boundary for a number of these. Can you go to the next slide, please? But now, recently, this article came out about a year ago showing that now there's data to identify the crossing of the planetary boundary for these what they call novel entities, but it's essentially chemical production. And that is because there's been such a large increase in chemical industry production, plastic, pesticide active ingredients, alongside those chemical constituents that are the precursor to making these many different types of plastics, petrochemicals, and pesticides that we now are increasingly more encountering in our daily life. Next slide, please. So I want to make this very clear. Petrochemicals are made from fossil fuels. Next slide. And that means that fossil fuel production, as I said, from in particular right now in the United States, from natural gas leads to chemical pollution. That is because natural gas, and in fact, even a component of the natural gas that comes off is kind of dirty, and they use it to make these different types of precursor chemicals that are used to make intermediate products, including vinyl chloride, styrene, polystyrene, PVCs, that then become the many different varied products that we come into contact with or use in our daily lives. This is really focused on plastics, so it's food packaging, clothing, tires, adhesives, all the components in your house. So many different things. And I just want to note some of the major producers of some of these are ExxonMobil, and the American Chemistry Council is one of the other groups that's highly involved in how we think about plastics. Can you go to the next slide? Oh, and then can you hit it one more time? And I just want to say that exposures to these pollutants occur along the whole life cycle of plastic production, whether it's people who are living near these natural gas extraction areas, so the frackers, the processing, so living near facilities that are processing or making these particular chemicals, or manufacturing or distributing it, or ourselves, which many of us either live near there, we could live near there, or we're using it, but then also the disposal, which then comes back through contamination of, for example, drinking water. Next slide. I just put this again because I think most people, well, okay, I'm just going to admit, for me, this was so interesting, is that it is more lucrative for these companies to produce ethylene, which is the feedstock for these petrochemicals, than to sell it for heat or electricity. So if you're a company like ExxonMobil, who is the biggest producer of phthalates, your market incentive is to basically produce more petrochemicals because you're making more money than if you were also selling it for heating. And with the focus on, I don't know, this may change, but the focus on switching out the economy, switching out the fossil fuel sector, so move to electric cars or electrification of houses. People who are making natural gas are looking towards new markets to sell their natural gas, which is going to be increasing production of petrochemicals, including plastics. And the production of plastics has doubled since 2008. It is projected to decrease over 400,000 or 400 or fourfold over the next 20 to 30 years, and it will account for more than a third of the growth in oil demand, and nearly half in 2050. So we are talking about a really major build out of seeing way more plastic and petrochemicals in our lives. Next slide. So this is data from EPA. I think it's trying to communicate, because these chemicals are invisible, really, right? They're like little molecules. You don't really see them, but they're being made. You see the products they're made from. But to really illustrate the extent to how much is being made currently in the United States, and the projections are more in the future, is there's about 9 trillion pounds of chemicals produced or imported every year in the United States. That's 30,000 pounds per person. So that is a lot of chemicals. And this is things like, this can include the chemicals like perfluorinated chemicals, flame retardant chemicals, phthalates used in plastics, bisphenols. This doesn't actually include pesticides because that reporting happens in another section, another place at EPA. So this is just for those petrochemicals that are used and regulated under the Toxic Substances Control Act. Next slide. So essentially, with us. We are living in a chemical soup due to the mass production of these chemicals. Next slide. And the exposures can occur in all the different ways that we interact with the environment, whether it's chemicals in drinking water, chemicals in the air, chemicals in our food supply, chemicals in the personal care products, or the other kinds of products in our homes that we come into contact with. And then, of course, very importantly, for those people who are working in occupational settings, including agricultural settings, exposures can also be occurring and at much higher levels than to those of us who are exposed through these other mechanisms. Next slide. And it's really one of the areas that we've really focused on illustrating, like we know that this is true because we know the chemicals are being produced. We know they're being used in the products. So we are exposed to them. And then we're exposed to them during these periods of time when we have increased susceptibility to the health effects from these chemicals. And so we've spent a lot talking about or monitoring the extent to which exposures occur during pregnancy. So this is from some work that we did early on using data that's collected by the national government showing that pregnant women are exposed to dozens of different toxic chemicals. These chemicals are all chemicals that we know are associated with increased health risks. And the other factor, which I think Jay also talked about, is that these exposures occurring during pregnancy can affect both the female whose body is changing very rapidly to support the development of the fetus, but also exposures occur to the fetus because the placenta is not a barrier. The chemicals go in. And so the fetus is exposed. And this is where it's the endocrine disrupting chemicals become their effects become magnified because it is important during this fetal development that there's very unique and rapidly changing activities happening as the fetus is growing. And so perturbations to that activity can lead to permanent changes that can alter the trajectory of development, leading to adverse health effects that can occur right after birth, in childhood, or even in adulthood. And endocrine disrupting chemicals interfere with the hormones, which are important for orchestrating the biological development during the fetal period. Next slide. So this illustrates that. So endocrine disrupting chemicals, these are chemicals that, as Jay mentioned, they interfere with hormones. They can make them go up. They can make them go down. Endocrines are super important during fetal development. They orchestrate many of the important formation of many important biological processes and functions. A good example is thyroid hormones. Thyroid hormones are critical during the fetal period for proper brain development. Decrements in thyroid hormones can lead to incomplete brain development and can increase the risk of, for example, lower IQ. So other estrogens and androgens are also really important. I'll talk a little bit more about those health effects, but the exposures that occur during development, childhood and adulthood, you can get these latency effects that may not occur, but you can also get transmission to multi-generational. And that is in part due to the fact that during the fetus's own reproductive functions are developing. So if you interfere in the fetal period with the reproductive capacity, whether it's male or female, in the fetal period, that then means that when that child is born and goes on to try and reproduce later, it can interfere with their ability to reproduce or manifest in other types of health effects that they pass on to the grandchild. Next slide. So this is an illustration from HEAL, which is a group in Europe. It talks about endocrine disrupting chemicals and their influence on female reproductive health outcomes. These are some of the health effects that endocrine disrupting chemicals have been associated with female reproductive health outcomes: breast cancer, endometriosis, infertility, irregular menstrual cycles, early menopause. And again, some of these well-known endocrine disrupting chemicals, BPA, pesticides, phthalates, perfluorinated chemicals. I think you're going to see a theme on some of these chemicals. And just to note that exposures are widespread, which we have documented, and that effects can occur at very low exposures. And that is particularly true for these susceptible periods of development when very small perturbations in the hormones during development can increase the risk of downstream consequences. Can you go to the next slide? So I want to also talk about the factors that can increase risk. So I think one of the what I'm going to end with is what we're doing to try and make the science more actionable so that we can prevent these harmful exposures. And one of the things that we need to we're working on is improving the recognition of the many factors that can increase or decrease your risk to exposures to these toxic chemicals. So there are factors that are intrinsic or biological in our body. So things like what age you are. So we talked about fetal or childhood, also older. So these different life stages can make you more susceptible to these exposures. Certainly genetics is important, though it's really not even the primary factor that drives many of these diseases. Pre-existing conditions or underlying medical conditions is really important. So people who already have an underlying chronic health disease, which many people in the United States already have, can be at increased risk from exposure to toxic chemicals. But then there's factors externally that also can increase risk. So things like whether you have other types of social stressors in your life due to poverty, food insecurity, racism and discrimination, difficulty in getting housing. Those factors can also create what you call chronic stress. We know that that can increase risk of adverse health conditions, that can exacerbate the risks from toxic chemical exposures, and certainly exposures to multiple chemicals, which we know is happening, also adds to the risk. Next slide. So this has been named the triple jeopardy of social inequality. So this can contribute to health inequalities in the population. The fact that you can live in a community or be part of a community that has higher exposure to toxic chemicals. You could have vulnerabilities due to the extrinsic factors, whether it's poverty, food insecurity, et cetera, or these biological susceptibility factors, aging, genetics. And together, these can interact and create additive or interactive effects that can magnify risks. Next slide. Can you hit this one more time? So basically what we see here is that if you start off, two people are starting off and there is early life exposures to some of these chemicals, that as the people who have more other types of chronic stressors due to where they live or their other kind of circumstances, that over time you can get essentially this chronic weathering that the toxic pollution adds to, that can lead to these health inequities between those who have higher exposures to these additional factors that increase risk compared to those who do not. Next slide. So I want to talk a little bit in detail about this and related back to pesticides. So this is data from CDC showing that autism has been increasing steadily since 2000. And this is from CDC has uses a mechanism to use the same diagnostic criteria over time at several locations across the United States. So it's not just so they remove some of the influence of changes in diagnostic criteria because it comes from this particular network of monitoring facilities. I want to note that their conclusion from the last year of data, which I think is in 2020, is that children born in 2014 were more likely to be identified with autism by the time they were 4 years old compared to those that were born earlier, born in 2010. So meaning that there's something going on that people, as we are seeing new generations of people coming online, I guess, or coming on, you're seeing that they have higher risks of some of these diseases. We're also seeing this for cancer as well. And you're also note that ADHD has also been increasing over the last 20 years. Next slide, please. So I think one of the challenges that we have, and this is, I'm just going to start nod to how we communicate about this, is people, and it's not just people, they're being told that the reason that we have these chronic conditions is because of these medical risk factors or risk factors that are due to you as an individual. But that is actually, certainly those are important, but they are also equally important is the contribution of these environmental chemical risk factors. So this is from a study. It's It's a little bit older, but this is from David Bellinger at Harvard, who basically looked at the factors that we knew about at the time in terms of medical risk factors. So preterm birth or brain tumors those can lead to decrements in IQ in childhood, as well as neurodevelopmental disorders or socioeconomic factors like failure to thrive or iron deficiency. And then he calculated in a hypothetical childhood population how many IQ points would be lost by these different risk factors. Can you hit the next slide? And you can see from these medical conditions, having this medical condition results in 34 million IQ points lost among the child population. Neurodevelopmental disorders is 40 million. Socioeconomic is 15. But just look at this one down here. It's methylmercury, organophosphate pesticides, so chlorpyrifos, and lead, which have are well-established neurodevelopmental toxicants, is 40 million. So the take-home message here is that, and this is only 3 of the many different types of chemicals that the fetus and children are exposed to, that is 40 million. So you can imagine if you extrapolate to the other chemicals that are not included in this list, that it is highly likely that chemical exposures dwarf what these other medical conditions are. And certainly they're equal. So I think the part of the challenge that we have is that the narrative is favoring these other conditions that are dealt with not by intervening to prevent these harmful exposures. Can you go to the next slide? Okay, so this is from the New England Journal of Medicine report. I want to say that something that has changed dramatically over the last, I don't know, maybe decade or so, is that the shift in the methods of how we evaluate the scientific evidence. So I'm not going to go into detail, but the point is that we now use a method in environmental health that arrives at a bottom line summary about the relationship between exposures, a hazard summary about the relationship between exposures and health effects that are not cancer. So if you're familiar with cancer, we have whether it's known or likely or probable. That didn't exist back in 2007, and we've done a lot of work to change that. And now we can say, look, these are other health effects that we know or are likely to be known related to these toxic chemicals. So one of the take-home points here is that we know enough. We don't need to do more science on these chemicals and their health effects because they're already known or likely to increase the risk of look at all these different health effects on here, whether it's PFAS, fetal growth, cholesterol effects, immune effects, orthophthalates and male reproductive effects, preterm birth, metabolic disorders, flame retardants and impaired neurodevelopment, bisphenols, female reproductive toxicity, metabolic or abnormalities, and down here, organophosphates. Could you hit the neonicotinoids and pyrethroids, impaired neurodevelopment and reduced sperm quality. And this is based on authoritative bottom line summaries, whether it's the National Academy of Scientists, EPA doing systematic reviews, the European Food Safety Authority, Cal EPA obviously is very important source for Prop 65. So, and these are all the same health conditions that are increasing in the population. Can you go up to the next slide? So this is from some work. Well, I'm sorry, these slides are, I updated them, but that's okay. This is from some work that we've done as part of the National Institute of Health, Environmental Influences on Child Health Outcomes. It's a large 50,000 mother-child cohort that's across it's a synthetic cohort linking different cohorts across the United States. And so some work we did very early on when I was actively participating in this was to develop new methods for biomonitoring chemicals that we previously have not evaluated in prenatal or childhood samples. And this is the results of this first study that we published on the pilot study. And I just want to point out that these were chemicals that were measured in greater than 50% of the participants. And these are also chemicals that many of them have not been traditionally biomonitored in national studies, but we identified them because we both expected them to be found in people's bodies, and we also know from ancillary literature that they have a high likelihood of increasing the risk of multiple different types of childhood diseases. So just to point out this, some of these are melamine and analogs. Maybe melamine is like a plastic-related chemical. This was found in every pregnancy in this cohort. And this is a chemical, for example, I think one of the other issues that we have a challenge in this field is identifying those chemicals that are under the radar and nobody is focusing on, but this chemical is linked to the doctored baby formula in China, leading to many ill infants as well as a few deaths. But I want to point out here that we measured a number of different fungicides and herbicides, and these neonicotinoid insecticides and a few organophosphate insecticides. And we found really widespread exposure to these neonics, which I think was, I mean, and for people on this call, it's probably not unanticipated, but I thought was a very important finding from the study. Next slide. And can you hit a slide again? Yeah. So I just want to point out that we also looked at how these exposures differed by different um, groups, comparing Hispanic and Black women to white women. And you can see for some of these bisphenols and parabens and phthalates are higher. I also want to point out that in the middle, these neonicotinoid pesticides and herbicides were also found at greater levels in the Hispanic women compared to the other groups, meaning there are higher, not only is there exposures happening, but there's higher exposures occurring to some of these groups can lead to health inequities. Next slide. So how are we working on, just check time. Oh, okay. So I want to talk a little bit about how do we connect this science to be more effective in moving these structural or systemic changes that can improve health for all populations. Can you go to the next slide? So I'd like to talk about um, about smoking. And this is a really interesting report. It's from a book that talks about the history of the first Surgeon General's report on smoking. And in this report, they have this this chart which shows the number of cigarettes per capita over time, which increased dramatically up until 1965. And this is when the first general's reports came out. So I just want to say tobacco was embedded in the economy. They were the third largest source of federal revenue, the fifth leading cash crop. It was an $8 billion. That's $80 billion. So they were $80 billion back in 1962. So not only did the government rely on them for taxes, but they also were generating a lot of jobs and money. So it's a very similar situation we have right now with these toxic chemicals. So this was a really, to take on this industry was a really big deal because they were so embedded in American society. And this was when the first Surgeon General's report came out saying that smoking increased the risk of, cause cancer. And then you saw slowly over time that different groups, so you had NGO groups start to get involved with this. There started to be more taxes happening. I think then you started to see essentially this kind of continuing increase in focus on this interplay between science, the NGO movements, and then various activities that have started to happen at local levels in terms of policy change, and then larger levels in policy change. And then you had the master settlement agreement when the attorney generals collectively sued the tobacco companies for essentially lying. And I just want to say in here, which is not actually on this, is when UCSF at Really Understand Glance received internal documents from the tobacco industry, which then revealed that the tobacco industry was lying. So you had to have different factors going on in order to eventually see these public policies that came into place that now most of us go to a workplace where there's no smoking, for example. Next slide. So I think we can learn a lot from that, the experience of that, which I'll talk a little bit more. But I want to say that we have done some public polling on toxic chemicals and how voters feel about this. We did focus groups and a survey. We talked to people who were Republicans. We talked to Democrats. We talked to blue collar workers. And it was we worked with Slinda Lake, who's a pollster, and she called this a unicorn issue. People uniformly agreed overwhelmingly that companies and the government should do a better job to ensure that we do not have toxic chemicals in the products that we're buying. Next slide. This is available on our website. So that's one thing that we've done is like people agree, but how do we get out this message? So one thing that we've been doing also is working with clinical community for them to integrate that toxic chemical exposures is an important risk factor for their patients. Because one, we're looking at who are the main messengers about health. Well, one of them is the clinical community and particularly physicians. So we've worked with the American Congress of Obstetricians and Gynecologists who have committee opinions, consensus opinions on toxic chemicals are an important factor for reproductive and developmental health. And then also the International Society of Obstetricians and Gynecologists called FIGO, Federation of International Gynecologists and Obstetricians, have also issued a consensus statement saying that reproductive health is being impacted by toxic chemicals. Can you go to the next slide? This represents over 130 OBGYN societies globally. And their first recommendation is to advocate for policies to prevent exposure to toxic environmental chemicals. This has been when we think about our strategy about how do we reduce exposures, number one is public policy because that is it's upstream. It's demonstrated to show that by intervening on public policy, through a public policy, to remove a toxic chemical will thereby result in a reduction in exposures to the whole population. And it's efficient and it's also, so it does also is more equitable because then it can help all the populations who are exposed. The other recommendations were work to ensure a healthy food system for all, and this also relates to reducing pesticide exposures, and the food supply, make environmental health part of healthcare. So this is a clinical recommendation and champion environmental justice. Next slide. I just wanted to point out that we have materials also about that we hand out to our clinical patients as well as in the clinic to clinicians and then for patients. And then, we have covered some of the main areas that we know about. And just want to note that we also talk about pesticides. Next slide. And these as an important risk factor. And we have this available on our website under Toxic Matters. Next slide. Which also has a component that has recommendations around pesticide use, both in your home and in your community. But I also want to point out that we are very deliberate about also including so everyone's always asking me, what should I do? And so, of course, people want to have some control over their homes or their lives. It's not their fault because they need to make the government work to also reduce these exposures, which maybe that'll come up about how that's going to work in the next 4 years. Can you go to the next slide, please? So, and then we also work with organizing scientists to amplify their voice in decision-making. Scientists have an important role to play in decision-making. We started this in January in 2017. We have scientists who participate actively in various aspects related to regulatory decision-making. Scientists are invited to join. The link is there. Can you go to the next slide, please? But we also have developed, which we developed actually for the 2020 transition, a set of strategic principles of how to advance better decision-making using best available science in the regulatory arena, because regulations, as you're well aware, are really drive whether the government regulates or not, really drive people's exposures to toxic chemicals. And this was a consensus effort that we did in 2020. We're actually updating that right now. We'll be releasing our new roadmap, but the principles are kind of essentially the same, which is and the reason this is important is because we need to have very specific recommendations about how science should be used to counteract those industry who does not, who has been putting out their own messaging on this. So it's to make industry pay for data collection. Lack of data does not mean lack of risk. A lot of times in regulatory process, no data means zero risk, and we want what mechanisms to deal with that. Better identify and protect populations in harm ways. Don't assume safety thresholds for population-wide exposures. This means that there's a risk to these chemicals at any level of exposure, and there's good scientific reasons for that I'm not going to get into, but you can read in our papers. There's 5 papers that went along with this. And the 5th one is conflicts of interest and the process. We've expanded this to be science integrity, but we have very specific recommendations that we've been working on with a collaborative group on how do we remove financial conflict of interest, corporate capture, and regulatory agencies. Can you go to the next slide? Yeah, I'm not going to keep going. So we do a lot of public commenting because there's under the Administrative Procedures Act, there's a particular mechanism by which EPA must, or any federal agency must respond to public comments. And since their science is not as good as the best available science, this could be an effective mechanism for that is followed up with a legal strategy. We talk to legislators about what's the best way to use science, and then we advocate for using the most up-to-date scientific methods for identifying the risks, hazards and risks from toxic chemical exposures. We also run a program called Reach the Decision Makers, which trains community leaders, healthcare providers, and scientists how to promote evidence-based policy at the state of California. Next slide. And I'm just going to end. Can you hit it one more time on, I guess it's not quite accurate, but that we are starting to focus on the role of corporations in producing the products that are really the driver of chronic disease and mortality globally. It's been labeled industrial epidemics. And this is that maybe the majority or 50% of premature deaths is due to corporate produced risk factors: tobacco, fossil fuel pollution, alcohol, processed and ultra processed food. It's like until we address the upstream and the fossil fuel industry, which is producing these chemicals, until we address that as an upstream risk factor, we will continuously be spinning our wheels. Can you go to the next slide? So we are working across UCSF campus. We are home to the Industry Documents Library, which is the source, has documents from many different types of industries, started with the tobacco industry. We have chemical, fossil fuel, sugar, also the opioid documents industry, and to work with faculty members who work on these different industries to collectively together work together to counter these industrial health harms. So the partnership is working to conduct research that empirically identifies the harms of products and polluters. We already have a lot of research in this area, but we're going to be increasing it and really looking at cross-industry collaborations. The tobacco industry as well, anyway, you can look on our website. We have more videos about the symposium we had last January. Identify and continue to reveal industry tactics, the financial ties and lobbying, and communicate to rebalance power. Next slide. So toxic chemicals, including pesticides, are ubiquitous, and we know they're adversely impacting health. Fossil fuels are clearly, it's an area of focus, is to really focus on the fossil fuel production and how that is contributing to this epidemic. And we really are very focused on how do we create structural and systemic changes to reduce this burden. And we have a comprehensive strategy to use best available science to remove financial conflicts of interests that pollute the entire research stream. And that will be one component of leading to better decision making. And I think that's the end of can you go to the next slide? And I want to thank everyone at all our funders and our staff. And if you go to the next slide, you can follow us on our social media channels. Thank you.
Thank you, thank you, thank you, thank you. Really appreciate the way you're presenting this because I think we're facing so many complex exposures. You mentioned the toxic soup, that it's sometimes difficult to figure out, right? How do we bring all the disparate parts together in a uniformed message? And having read your article in the New England Journal of Medicine and I mentioned Dr. Barbara Deminique's work. in France, that we are unified in that we are talking about petrochemical pesticides, and we have to stop thinking of our work as being siloed, right? That I only work on pesticides, or I only work on plastics, or I only work on, PFAS, which is also pesticides, because there is overlap there. So are you finding, and here's the question, I think. You testified back in October of last year, right?
Mhm.
Before the House and Energy Commerce Subcommittee on Environment, Manufacturing, and Critical Materials, long name. And you were on a panel with a lot of chemical industry, a couple of CEOs, head of the trade association for the chemistry and chemical industry. And you went right into the belly of the beast and you said straight up to members of Congress, I assume there was at least one member of Congress at the hearing. Um, and you said it is important to hear from all affected stakeholders, which they don't usually hear from, as evidenced by who was on this panel. However, it is also integral that we have health and environmental regulations that use independent scientific analysis, and here's the key, free of financial conflicts of interest or strong bias toward the perspective of regulated industries that have a vested interest in minimizing EPA's regulation of hazardous materials and products. I should point out that you also in your testimony pointed out that industry will do very well in a shift away from petrochemical pesticides. It's not as if we have to give up our quality of life or our health or our safety. And the same is true for pesticides, in terms of, management of insects, food production, playing fields, gardens, what have you. But I think you've hit on what's holding us back, right? That there are vested interests that are simply holding us back because this is the way they do it and this is the way they make money. So my question is, and there have been a lot of questions coming into the Q&A about specific products and how do we eliminate them? And, these are very detailed conversations about how we make this transition. But my question is, what was the vibe in that room?
Well, they had a lot of people there. So I went there. UCSF has a congressional relations person, and I mean he's great. But he was there. They each came in with an army of suits. It was like, wow, that's pretty impressive. Nonetheless, we didn't need an army, so it was fine. Uh, it's interesting. I mean, I think one thing that is really important is they're very well organized. They have all their talking points. They really have nice clothes, and they had all their the Republicans are very nice. They're very friendly, but they had it. It was like a dance. They had it all, the performance. It was all set up, right? They had the opening remarks, and then the Republicans all knew which question they were going to ask. They had their set of questions. They had these amazing visuals that they brought up that were, I thought they were kind of funny, but maybe they thought they were effective about, these yellow syringes. And it was about ethylene oxide, about
Right.
how EPA was going to ban ethylene oxide. And then they had very
Which is the
specific talking.
sterilant used in the
Sorry,
medical
right.
team.
It's a sterilant used to sterilize medical equipment. So of course I mean, they had a very specific set of talking points, which is if we don't have ethylene oxide, we will all have to use dirty needles. That was literally their talking point. And I mean, I think that it was clear that they'd orchestrated all their talking points. They had different Republicans give different points. They had different, because they have a certain time limit. And then they asked questions to the different other panel members. They didn't ask me any questions because they knew what I would say. And I think they're very organized. I had maybe one Democrat wandered in the room during the whole thing. I mean, or maybe there was two. We're very disorganized. I'm not gonna lie. It's like the Democrats are not, they don't really feel the burn on why do we need to stop these toxic chemicals? How do we make sure that why are these companies, because they're not, I don't, that maybe there's a lot of things going on, but it's clear that the industry has been working very closely with the people they think are going to advance their message. They've been working very closely with the Republican staff. They have certain talking points. Their talking points are not, they're very refutable and not based on the complete understanding of all the data, but it doesn't matter because Democrats aren't showing up.
Yeah.
And I think
Yeah.
maybe that is the lesson from this election.
Yeah.
Like you got to show
And a
up and
lot
you
of
got
these
to
things,
be
as you
there
said,
and have an organ. It's not that it's that complicated. It's really about anyway. So that was, I mean, the chair was very nice. It was very
yeah,
friendly. Came up and talked to me afterwards. That was nice. That was very
yeah,
pleasant.
yeah. So I know you've worked on and you put some effort into the banning of clopyrifos and talked at the state
Oh yeah.
level.
Right.
That's an organophosphate insecticide that had originally been banned by EPA, but then reinstated by court decision. Um, how do you find that there's a greater receptivity at lower levels of government? Have you had that experience, like at the state level or even at the local level?
I would say local. California was not going to ban chlorpyrifos. The governor made them do that because it was politically too toxic to not do it. The DPR wasn't going to ban chlorpyrifos. I think they had some reasoning around like, oh, well, sure, it's toxic, but the exposures are so low, it doesn't matter. But
Right,
because the method, I just want to say, the way that the system is set up is that the structure of how the science is used in hazard, now that's changed because that was one thing we like been very focused on changing, has gotten better. But the risk assessment method, I mean, they have a whole, is all set up to be favorable to downplaying the risks to these chemicals. So we have a very specific set of recommendations based on what the National Academy of Sciences has said and what other authoritative scientists have said about how we need to change those rules. I think the thing that's really hardest for people to appreciate is like we're basically playing in a sandbox with rules they set up. And we have not been successful in changing those rules. But and
right.
we saw a little bit of this in the Biden administration with the PFAS in the drinking water standard, where and I know it's going to go a little bit deep, but the EPA issued a rule to remove certain perfluorinated chemicals from drinking water.
Oh, I think we lost Tracy. Okay, Tracy, you're not there. Can folks, there you go. We
Oh,
lost you for a
sorry.
minute there.
Oh, yeah, my internet, people get off the internet here. They monetized, they first of all said that PFAS increased the risk of low birth weight babies. That was based, I mean, that started when we did a systematic review on that. Then the National Academy of Sciences blessed it, and then EPA monetized that. And then it turned out that that was a pretty significant component of the monetary benefits. They also included cardiovascular, improvements in cardiovascular health because of the dyslipidemias. Also, the National Academy of Sciences said that was a health effect. And the other one was cancer. And the benefits from this were so much higher. Before, EPA would never have included it because they didn't have you know, a, a clear bottom line summary about that this is a health effect and here's what it linked to. The drinking water rule, just for the low birth weight benefits, because a low birth weight baby has an increased risk of infant mortality, is driven by the fact that there will be less infant mortality after the PFAS rule is implemented. And it's like significant. I think I calculated it's like it could be somewhere around between, 8 to 10% reduction in
Wow.
infant mortality from that. These are like big numbers because everyone is exposed. And I think so for us, we're like very focused on how do we elevate. I mean, it's true that risk assessment isn't, it's gamed, but that's where we are, and that's where we're going to be for at least the next 4 years. So
Well, that's a good note to end on. We're losing you, Tracy. We need to talk carefully about risk assessment and how it is biased often and brings
I
in
have to.
data that's not realistic. We lost you at risk assessment, which I think would open up a whole new conversation about how do we do better risk assessment, and how risk assessment is not adequately protective, especially of vulnerable population groups.
Right.
and
Yeah, sorry. I don't know why the internet is going out, but I just want to say that, right, it is the rules of the game right now. So we're very focused on how do we change those rules so that they're correct. And actually, if you change them, you will see that we have been undervaluing the risks and that the risks are, you will actually lead to a lot better and more decisions.
Great.
Obviously
Well,
better, different, but
I think that's an important message and one that we, as we segue into this next part of this session, that we need to talk about in terms of what advocates have experienced at the local level when explaining the limitations and the
right.
deficiencies associated with the regulations of products we're exposed to every day.
Right. I
Yeah.
mean, it is true, there's a lot of focus on on a hazard-based approach, which we agree with. Um, and so a lot of the work that we're doing is really when you're in the regulatory setting, though, and the way that the laws are set up, it's really you have to you don't necessarily have to, but there's a lot of them that are driven by this technical approach. So,
Right.
I think there's different strategies that are going on at the same time. I'm not.
Well, I hope you can stick around for a little bit because we're going to talk about some of those strategies in the next
Okay.
part. I know you have a busy schedule today. So thank you so much, Dr. Woodruff. Your expertise, knowledge, insights, and the rigor with which you approach this topic is really incredible, and we're all thankful for the work that you're doing. So thank you for joining us.
Yeah, well,
And
thank you.
yeah, so let us switch now to the roundtable discussion. Thank you for sticking with us. We have uh, an extraordinary panel today. And I am personally and professionally honored today to have assembled a remarkable group of panelists for the roundtable discussion. They all serve or have served in leadership positions in advocating for a livable future. Please see the details on their extraordinary backgrounds on the forum webpage. I'm not going to go through them in detail right now, but I'd like to ask them to join us on the screen, if we can do that. Great, thank you all. I'm going to start. First, I'll introduce Millie and ask you to wave when I mention your name. Millie Trevino Ceseda, the Executive Director and Co-founder of Alianza Nacional de Campesinas, the first national grassroots farm worker women's organization. She is joined by Amy Tamayo, Policy and Advocacy Director at Alianza. And then next, I would like to introduce Janet Noodleman, who is the Director of Program and Policy for the Breast Cancer Prevention Partnerships, BCPP, a national organization working to eliminate toxic chemicals and other environmental exposures that lead to breast cancer. And finally, Les Toward, PhD, is the Senior Science and Policy Advisor to Beyond Pesticides. Dr. Toward is a former EPA senior biologist and member of the EPA's Endocrine Disruptor Screening and Testing Advisory Committee. So I'd like to give everyone that is on the panel, I'd like to give you an opportunity to give you a sense of your response to the talk that you heard. But let me remind folks in the audience that you can use the Q&A link at the bottom of your screen to send us questions. I'm going to start the conversation today with someone who has had years of working within EPA and has insights in how the process of protecting people and the environment works and doesn't work. Then go on to Janet, who will talk to us about how BCPP, Breast Cancer Prevention Partners, has rallied people and decision makers to fight endocrine disruptors and other chemicals associated with breast cancer. And then we're going to hear from Millie and Amy on their involvement in fighting pesticides on the front lines and the different strategies and tactics that have been used and are being used. So, but before we get to the detailed questions, I did want to open this up to give you all, each one of you, an opportunity to introduce yourselves and explain the work that you have been doing and have done, and why it's important to public health and sustaining life. Please feel free to use part of this time, if you'd like, to reflect on Dr. Woodruff's talk and the enormity of the problems and the solutions discussed from your perspective. So why don't we start with Janet and then go to Millie and then Les.
All right, terrific. Thank you, Jay. I so appreciate being invited to be a part of this forum. And thank you, Tracy, for that inspiring and always informative talk that you presented. You know, I'm one of your biggest fans. So quickly, just a little bit about us. Lots of organizations are focused on breast cancer screening, on treatment, on access to care, and that is, of course, so important. But Breast Cancer Prevention Partners is the only national advocacy organization solely focused on preventing breast cancer before it starts by eliminating the toxic chemicals and other environmental exposures linked to the disease. So why do we do this work? Why is it so important? Because, of course, everyone has been touched by breast cancer or will be touched by breast cancer. Globally, it's the most common cause of cancer deaths among women, with 2.3 million cases, new cases every year. In the US, today, a woman's risk of breast cancer is 1 in 8, and that's up from 1 in 22 in the 1940s. But what's even more alarming is that the rates continue to increase for all women at about 1% per year. But what's really shocking is for young women, women under 50, at double the rate, at 2% of an increase every year. And why is that? What we know about breast cancer is that it's a complex multifactorial disease and there is no one cause of breast cancer. But what people are really surprised to hear is that within that complexity, family history or genetics only makes up 10% of all breast cancers, which is why we're focused at BCPP on chemicals that are linked to breast cancer in our consumer products, in our workplaces, in our communities, getting those chemicals better regulated and better disclosed so that people can make more informed choices and decisions about the products that they bring home into their home environments and into their workplaces. And we're focused on that increasing body of scientific evidence that Tracy talked about that's linking chemicals in our environment to an increasing risk and rate of breast cancer and other diseases. So one of the big families of chemicals that we're concerned about are, not surprisingly, endocrine disrupting compounds. And the reason why is because these chemicals are hormonally active. Many EDCs act like estrogen, and our bodies don't know the difference between naturally occurring estrogen and these xenoestrogens that are created in a lab. And these EDCs are not just linked to an increased risk of breast cancer and other cancers, but as Tracy mentioned, to early puberty, to decreased sperm count, to infertility in women, to birth defects, et cetera. And what you also heard from Tracy is they're not just in pesticides, but they're in formulated products like cosmetics and food products and cleaning products. They're in textiles, they're in building materials, carpet, furniture, et cetera. So we've done a lot of work over the past 20 years getting these EDCs better regulated and better disclosed. We've been successful in getting BPA banned from baby bottles in California and at the federal level, also in infant formula. Convincing the world's largest canned food manufacturers like Campbell's to stop using BPA to line their canned foods. We also got phthalates, which is another family of endocrine disrupting compounds banned from kids' toys in California and at the federal level, also banned from cosmetics in California. And most recently, with Tracy's help, we got phthalates, one phthalate, DEHP, banned from IV bags and tubing in California, which is incredibly important. Most people don't even know that phthalates are in their IV bags and tubing. And what's really shocking is that they leach from the IV bags and tubing. They're not a stable molecule into the medicine being transfused into patients. And in the case of chemotherapy, I mean, it's just mind boggling. They actually stop the chemotherapy from killing breast cancer cells. Like, how can that even be possible? And what I'm going to talk about in the next part, when you ask me the question, is the number one recommendation that Tracy called for. And that's that we need better regulation of chemicals, not just endocrine disrupting compounds, but all chemicals at the federal level, at the state level, at every branch of government, at every level where policymakers can do something about the problem, because otherwise we're just playing whack-a-mole. I'm going after one chemical at a time.
So I'm glad you mentioned local, state, and national, because we're getting a lot of questions. How are we going to do this stuff under the next administration, which Tracy alluded to as well in her talk. So thank you, Janet. Thank you so much for all the work you do. And Millie, you've been at this a long time, so we'd love to hear your background and then how you see us moving forward.
Wow. Don't get me started, Jay. But I'll try to be short because I do want Amy to share in terms of how Alianza has been working so far, and how when I say Alianza, it's not only Amy, it's with a group of organizations that are participating here within our membership. And I do come from a migrant farm worker family. I did farm work ever since I was little. When I say little, I was 8 years old, and with my siblings, the same thing. It was a need to help the family. It was a need to help sustain the family, but because of that, I mean, there were just so many different layers of issues that are happening within, and not only during my time, but we still see it happening right now. In terms of the pesticide being applied while workers are still working in the fields, quote unquote, it's because, sorry, we made a mistake and we're spraying the block that was supposed to be the next one. We did the wrong block, and while that is workers are being sprayed and they've been injured, and then we have found many situations where the crew leaders or the foremen or the supervisors are not necessarily prepared to even deal with situations like that. Sometimes when I hear, because still cases have been happening this last year, where I can say that not only of the spraying of people while they're working, but the long-term effects, or the effects of when women are working that are pregnant and end up having either a miscarriage or having premature child, or end up having children with birth defects, like Janet was talking about. And we have many members that have had these situations where children, actually, there's in California, because California is the state that has much more agriculture than any other state together, just any state. And what does that mean? There are more quote unquote protections here, but they're not enforced. Lack of funding for all these resources that need to be there to provide the kind of support. When this next administration comes in, we already know. They only ended up naming us being being what did they call us? Essential? Really? They only called us essential because they wanted us to continue working. Because if the companies would stop production, then what would happen to the country? You know,
Right.
we would be without food.
It's sort of
But
ironic given all the other things they said about the
very
immigrant
ironic.
community.
But we were not treated as essential. We
Right.
were not provided everything that needed. You would go to a Costco or you would go to any other store, you know, they would make you wait because it's only a certain amount of people and be away from each other, 6 feet apart whatsoever, have masks, have gloves whatsoever. In the fields, you would not see that. You would not see that. Or even in packing houses, you would not see that. And many workers ended up dying because of the exposure and because workers could not stop working because they were afraid of being fired. Uh, and to top that, you know, the chemical exposure. Now, I will say that there are many of our members, and I'm referring to our members. This is aside from all the thousands of farm workers that have been injured, and by age 40, they're they're not they're not as strong as they used to, not just because of the age, it's because of all the exposure that they have had. 35, 40, you're already having a lot of health issues. And a lot of it has to do with the pesticides. And workers are still being told, hey, don't worry, by the crew leaders or by the foreman or the supervisor, that don't worry if there's a strong odor or you can't bear the smell of it or whatsoever. It's medicine for the plant, so don't worry. What do people think? If it's medicine for the plant, it's medicine, so it's not going to affect you. So people don't have the right information, and if they have the right information, we have also had people that workers that have come to us and have shared that they've gone to the agriculture commissioner, or they've tried to exercise their right to go to a doctor when they've been sprayed, and they're threatened. They're taken directly to a company doctor, and the company doctor doesn't do everything that they're supposed to whatsoever. I mean, there's stories where then the agriculture commissioner says, "Oh, well, we don't have enough evidence." Evidence for what? You know, she was sprayed, or they were sprayed. So, is there going to be a fine or not? You know, if these situations keep happening this way, you think that workers are going to be, you know, encouraged to do any kind of reporting? No. And then, you know, EPA and all these agencies keep saying, well, we don't have enough reports for workers to be able to say that there's so much harm in the workplace by the pesticides. Of course, because workers don't know. And
Yeah.
if the ones that do are not provided the proper care, that proper health care, if there's any,
Yeah.
because
So
and
Millie,
in the southern parts of the states that are connected to the border, you know what many companies do? They take the workers on the other side of the border, or they ask the workers to go to the other side of the border.
for
So that
healthcare.
will not be reported.
Right.
So it's a lot of this that's
So
still
these are
happening.
systemic problems you're describing, and we're going to get to some of the maybe solutions to some of these things or strategies. Can we introduce Amy?
Amy,
Yeah.
go ahead.
My name is Amy Tamayo. I'm the National Policy and Advocacy Director with Alianza Nacional de Campesinas. I'll be able to share a little bit more later on, but just want to give a very brief overview of some of the policy advocacy work we're doing. You know, Millie laid out the landscape that we're that we're up against. There's a lot of systemic issues that are making farm work very dangerous and very harmful for farm workers, particularly farm worker women who have sometimes more susceptible to more health harms from the endocrine disrupting chemicals they're exposed to. And Alianza has been able to organize across the country right now, across 20 different states, and pretty soon in 40 states. And we've developed working groups to address specific topics related to environmental justice, pesticides, workers' rights, immigration, and violence against women. And we also meet every 2 years in DC, where we bring hundreds of people to come speak directly to their representatives. But in between these big events, we also are regularly informing the public, medical and research institutes, advisory committees to different agencies, and as well as our representatives and senators, to make sure that we're raising awareness of what we're seeing on the ground. We're using all of the issues that the farm workers are bringing to us to develop policy recommendations, to give feedback to regulatory proposals. And, one of the other avenues that we're involved in is legal action, which I'll share a little later. So thank you for the opportunity to be here, and I'll pass it back to you, Jay.
Thank you so much. And congratulations on all that organizing. I know that's a tremendous effort, and I think it will pay off. So congratulations on doing all that. Les, I'm gonna sort of, in the interest of flexibility here, I'm gonna jump right into the question that I had for you, and feel free to reflect on Dr. Woodruff's talk. I actually have a lot of questions for you, given your experience working at EPA on endocrine disruptors around the time of the passage of the 1996 Food Quality Protection Act. And my questions fall into two parts. One is, historically speaking, what kinds of resources, internal and external, to the agency were brought to the work that you were doing on developing a process for evaluating endocrine disruptors? And why do you think the process got bogged down? How important is the influence of non-scientific or industry politicians that you saw internally, or did you see internally, over scientific process or needs? And then, if that wasn't enough to ask you, let me ask you to reflect on what you see happening currently, given your current review of recent EPA proposals for moving forward with the regulation of endocrine disrupting pesticides. And is the agency thinking broadly enough in the context of endocrine systems, species, and ecosystem health? That's a lot of questions, but I'm hoping you can tie them together somehow.
Okay, thanks, Jay. And there are a lot of questions there, and there's a lot of information to go in it. One thing, just as a correction, in your introduction, you said I was a member of the EDSTAC committee. I was on the screening testing subcommittee of the full EDSTAC committee, because EDSTAC is a Federal Advisory Committee Act, committee.
Right.
And as an employee of the agency, we weren't allowed to be part of that, since we're not advising ourselves. But in support of the main committee in terms of screening and testing, my experience, given the various test guidelines and the interactions within that, was the purpose of that. And that
so
kind
it's sort of like staff to EDSTAC in a way.
Yeah, I was, basically wrote the chapter on screening and testing for the EDSTAC, right, and the members,
Well, thanks for that correction.
It's just but it's a good point in terms of how the FACA groups, because your question in terms of what resources and stuff the agency was utilizing, we did follow the Federal Advisory Committee Act, established an advisory committee, formal committee, which has a lot of rigmarole, I guess, that goes into that. But they were experts, that were both from academia as well as professionals, and partly the industry scientists and stuff as well. But within the fact that they were involved in preparing recommendations for the agency in terms of how do we deal with this concern, because with the Food Quality Protection Act, the legislation basically listed estrogens and validated methods. And it also allowed for other things to be considered based on the administrator's approval, but that seems to get, I guess, underrated in context. But the validated method aspect of that put a lot of onus on the agency in terms of the methods that we would be recommending to be done, because the EdStack itself, I recognize that the existing studies or data that the agency had available for the conventional pesticide toxicity risk assessments was insufficient to really consider all the endocrine elements that were there. And estrogens, really just one, but the EdStack recommendation was because of the existing data sets that we had, that we could really basically focus on estrogen, androgen, and thyroid as the initial group to go. And then we could develop other methods as they would come along. So, but it's been, 25 years, we're still stuck on the estrogen context. But the part of the, I guess, the logjam, or whatever you would like to call it, it's the bureaucracy within the agency is key, because within that you have a variety of different offices with pesticides, and internally within the pesticides you had the eco folks and the health effects folks, but you also had some of the external offices like the Office of General Counsel, the legal aspect, as well as the Office of Management and Budget, which is external to the agency, that would have some input into what we could do going forward and not, and where focuses should be. But the also within that, internally within the agency, you have a lot of infighting, because one thing that the EdStack folks, recognize what there's as a human-wildlife connection, that the endocrine systems cross over the various groups. And EdStack also recommended that seems to be forgotten, that we should include invertebrates in context in some way, although they recognize that the initial focus was going to be on the estrogen, androgen, and thyroid in vertebrates. There are still other hormone systems, and there are some related hormones between the invertebrates and vertebrates, but the context was to focus primarily on the vertebrates. And traditionally within the agency, human health tends to take precedence over the eco kind of thing. So that was another context in terms of the eco side really had a little bit better understanding of some of the endocrine concepts, but the human health folks figured that, well, the eco guys, the wildlife guys, especially invertebrate guys, they're not as up to date on endocrine type issues, which is, that's a debatable point. But actually, my initial start on the endocrine side was back in graduate school. For my dissertation, I worked on a crustacean, a grass shrimp. And the purpose of that was to evaluate these insect growth regulators, insecticides that really attack the endocrine system. And the concept at the time was, well, can a insecticide affect a population? Can an endocrine disruptor impact a population? Well, the industry had already proven that in terms of with the insect growth regulators, they were very effective at controlling the insect populations just through endocrine disruption. But I would, I guess, in terms of your question, was the agency really broad enough in considering other various aspects? And although the EdStack recognized that there are other systems, those weren't highlighted initially, but later within the office, we were looking at the other various ones. And we did a detailed review paper of other pathways, other methodologies that could be brought into that. But other resources that we were tapping into at the time for developing these test methods, which we had to validate. And the validation process is a cumbersome process that we had to go through a lot of hoops, which is, I mean, we were validating against what? I mean, the method that we were utilizing was the initial method, so we're not validating that it's, that method's there. But we wanted to utilize it in terms of, was it identifying the particular activities that we were concerned about? But the other aspect was standardizing, the method, ensuring that other laboratories, multiple laboratories, could do the test and get the reasonably close to the
So
same
before
answer.
EPA could issue a regulation to regulate endocrine disruptors, just so everyone understands, you guys had to have these validated methods that could be used across the industry, essentially, through various laboratory practices that the agency would establish as protocol to move forward on this,
Right.
right?
And along those lines, the industry has the burden of providing the information to
Right.
the agency. But that's a whole nother story.
That's a whole nother
how the
story.
burden
So
works.
here's before we move on, and we'll circle back in this conversation. But Tracy did put her neck out there when she went to Congress and said, look, things aren't moving forward. It seems like there are a lot of vested interests in the room here that are controlling what's going on, and there's not much going on. And you mentioned 25 years, we haven't seen the progress that was mandated by Congress. Do you, when you're working inside EPA, do you feel that pressure that she described to Congress? Do you feel that industry pressure holding you back?
Well, in the context, I mean, the industry always has an influence in terms of what the agency is doing. The agency is sensitive to that. The agency is also sensitive to you know, court cases. I mean, if they're sued
Right.
and from the outcome, they have to make a decision to go forward with that. But they're also affected by other international, contexts that are working, but also political. If a congressman calls up, the administrator or an assistant administrator and wants to know this or that, that congressional inquiry takes precedent, and so staff time is spent trying to develop a response to that. So by contacting congressman raising concerns, if the congressman's going to respond to that particular question, he will come to the agency, and so that causes some effort, but that's usually time being spent on that as opposed to other things. But it does have an influence in context. But there is a distinction within the agency between risk assessment and risk management. And so the staff scientists, the folks working on and reviewing specific studies, we might find a kind of a conclusion or recommendation, but risk management takes that and spins it the way that they want to.
Right.
Which
So the
can,
science can be undone by the risk management assumptions in
and
the
that
risk
happens
management.
fairly often. I know with Tracy, I was interested to hear her mention chlorpyrifos in context, because that was one of the chemicals I first worked on when I was early in the agency, and that was in like 1980. But at that time, we were basically saying we need more data. There was limited data available at the time, and so I might request that. But then the risk managers could, in the early days, we had what was called conditional registration. So the agency would allow pesticides to get on the market on the condition that we would see some data at some future time.
Right. Which
But
is
the
still a
problem
problem
is
today, by the way.
yeah.
So let's hold that thought, and as depressing as it is, because science is not the only thing driving the process here. I think we've established that. And so we turn to the advocate who is pounding the pavement every day, trying to explain this horrific situation. And that I'm going to turn to you, Janet. Of course, you're smiling, so I'm doing that. And this is sort of a two-part discussion. The first part starting with the concept of dealing with people in elective office. I mean, what you've described, Les, is how we see it every day. A congressional office gets a call from a constituent. It's a chemical company, or it's a grower, or it's somebody in their district. They make the call to the administrator, and then all the resources shift to answering that question. Not all, but a lot of resources shift. Things can slow down, and you know the wheels of government are affected by the politics at that point. Um, so Janet, in your world, as you already mentioned the success you've had on different materials and policies, how do you break through to an elected official, knowing what you know about the deficiencies or knowing what you know about endocrine disruptors, knowing what you know about the deficiencies in the regulatory process that allows products on the market? Many of these elected officials, most are not experts, they're not scientists in this realm. How do you break through to them? How do you get the conversation going?
Well, I want to start by saying we do a lot of our work at the state level. BCPP is a national organization, but we're based in California. And as the third largest economy in the world, when California enacts a law, it serves as a de facto law of the land, because companies aren't going to just reformulate their products for California. They'll make that same reformulation available nationwide. And other states tend to pick up the policy models that California has created. So out of the 20 policies and regulations that we've been successful in championing it in at BCPP, 16 of those were California laws. And so I want to start there. Where we start the conversation always with policymakers is by bringing them the science, because they're not going to make a change. They're not going to ban a toxic chemical unless the science shows that it's toxic to human health or the environment. So we start with that growing body of science. We then make it clear that the public cares. So public mobilization is really, really important, of course, for obvious reasons. One thing that's kind of different about how BCPP does our work is we work really closely with sustainable businesses, because neither the California legislature or the US Congress will ever make a change impacting manufacturing practices unless we can point to safer alternatives. They have to know that there's a safer product that can fill that void that the chemical that we're banning is going to take out of commerce. And something else that's really important that Tracy mentioned. I was so fascinated when she said that you can show an 8 to 10% reduction in infant mortality through the PFAS rule. Like, that's huge. We know that showing the impact of policy change to policymakers is going to really help convince them. Like, we did a dietary study where we gave families food packaging that was not made with BPA or phthalates, so glass packaging basically for their food. And then we gave them food that came from like places that weren't using BPA or phthalates in the food packaging that could have leached into the food. So we gave them whole foods to eat for a week. And in just a week, we saw significant reduction in BPA and phthalates in their bodies. So we were able to say to policymakers, you take BPA and phthalates out of food packaging, you're going to take them out of people who will pee them out through their urine within a week. Like, that's huge. So showing policymakers that their policies can, in fact, real people's health in real time is really important. So those are ways in which we were able to get our message across to policymakers, and again, and enact real change. And I just want to say one last thing, and that is that we work at the state level because the federal practice of regulating what little chemical regulation exists is so badly siloed. And you had yourself said, Jay, why siloing our work is so ineffective. Chemicals are regulated by the product categories that they're in, not by the chemicals themselves. So you've got the FDA regulating cosmetic safety. You've got a different office at the FDA regulating food safety. You've got the EPA regulating chemicals and cleaning products, specifically disinfectants, because they regulate them as pesticides. You've got OSHA regulating cleaning products used in industrial settings. And then you've got the EPA creating action plans for phthalates, but then they don't share those action plans with the other federal agencies. So until we can stop that siloing and the partisan gridlock that Les, mentioned, and the industry influence that Tracy mentioned that smacks all of our work down, we're never going to see real.
Okay, so could you envision a bill in California that would be cross-cutting? Obviously, it would ignore these silos that are hard to ignore and challenging to override. But nevertheless, a cross-cutting piece of legislation that would say, look, we know enough about these endocrine disruptors. We know enough about what they're doing to overall health, multi-generational effects, every category of major diseases that affect our families, the ability of our children to think, autism, and write that bill in a way that was cross-cutting across agencies, chemicals, workplaces, et cetera. We sort of did that in the Food Quality Protection Act, where we recognized that it wasn't just the pesticide law, but it was actually the food safety law that also was in play. And so that bill amended 2 statutes. Why couldn't we take something like that in California? We're all going to move to California, by the way, because that's where the influence is. But is that something you could envision as feasible? Audacious, in the audacious category.
Well, what we've started doing in California, and the states who coordinate a lot of their state legislative advocacy are doing, is asking legislators to regulate chemicals as a class, to get away from that whack-a-mole process.
Right.
And as a result, in California, we've championed the passage of 4 different laws that regulate the entire class of PFAS chemicals.
Yeah.
In food packaging, in firefighting foam, in cosmetics, and in textiles. So that's a really big deal. But looking at broader chemical policy reform in California is really just as political as it is at the federal level. But
Yeah.
it's something, of course, that we want to do, we're trying to figure out how to do, but no one's cracked that nut.
Right. Okay. And what about local level work? Is there an experience there that you could share?
So the very first thing that I worked out when I went to work at BCPP 23 years ago was enacting a precautionary principle ordinance in San Francisco. And it was the first in the world. But that's just San Francisco. So local change matters. I mean, Millie talked about it. Everyone, we know that, look, people care about the communities they live in desperately. And I think that's why the Republican Party has been so successful, is they get people involved in local politics, then they get them to run for the Board of Education and the community college board, and then they send them to Congress. Like local is where it's at and where it starts, but we need a federal government that protects all of us, because if you're not lucky enough to live in Berkeley, right, that protects everyone from everything, then your life's going to kind of suck. And we know that. We look at the rest of the country and we see how badly it is for people that have Republican held local governments, state governments. And so at the end of the day, we need to figure out how to get Congress to care, get the right people in the White House. And that's when everyone's going to be protected.
Yeah. Okay, well, we have a little bit of time to work on that. So let's, moving over to Millie and Amy. I know you guys were involved in a landmark case recently that was settled on endocrine disruptors. It was counseled by the Center for Food Safety, and you're challenging EPA to do its job in regulating endocrine disruptors. Millie, I was really intrigued by your quote, and it, obviously it was a settlement, so you had to zero in on things that the EPA would agree to do. But it will get the ball rolling certainly on some chemicals related to estrogenic effects of pesticides. But when the announcement came out, Millie, you said that more work is needed to ensure that harmful chemicals are removed entirely from our fields and communities. And I'm curious when you join the litigation and then even beyond that, that's a pretty bold statement. I know it comes out of years of experience around the limitations of the Farm Worker Protection Standard, the Worker Protection Standard, and the lack of EPA attention to elevated risk factors among workers in the fields and workers in food production. How do you grapple with that? You mentioned essential workers earlier. One of the things we learned, the whole public learned about, I think that we all have known for many, many, many years, is that there's something called personal protective equipment, and there's something called reentry standards for farm workers in the fields, and there's something called hand washing facility and sanitation facilities, and you know, notification issues. But as you said earlier, there's limited enforcement of a lot of that stuff. How are we going to ensure that harmful chemicals are removed entirely from our fields? Is that something you can envision happening? And how do we grapple with that? How do we take that on as an audacious effort? And how do we rally community support? We got a lot of food eaters in this country and around the world that should care a lot more about the workers that harvest the food. How do we get this done?
That's a long conversation to start with. But I'd like for Amy to also join here. But what I know is that uh, several organizations like ours, and Alianza is an 18-member organization. Líderes Campesinas, as you know them, Jay and Janet, you might know Líderes
Yeah.
Campesinas because in some part of the time I was the director, there was some support that you provided our members because we were dealing with, and it's so true, the breast cancer issue and other cancers. Uh, what we know is, and the more we are able to open dialogue in our communities is the better, where people are more aware and more supportive in terms of how hard it is for uh, maybe people might not know that, or maybe they do, but in terms of how hard it is for any kind of issue, if people are not aware or people are misinformed, it's very easy to not get the support and from the same community. So it's even harder to even at times have conversations. But it has taken us a long haul uh, um, in in having the not only the conversation about the issue, but how can we support each other uh, by really understanding that by supporting each other is going to help not have more pressure from the community to be able to do something to create the change that's needed. And I will say this, like for example, uh, in the early 2000s, there were several groups of women that came to Líderes Campesinas that have their children with special needs, birth defects, and many other issues. It all depends, different places around California. The women were meeting, just to support each other, to see in what way they could see, um, uh, something for their children, because they didn't know what to do. They only knew when they were taking their children to a doctor that there might be like a program that could help them because they were born with special needs. But that was it. They didn't know anything else. Then with us, they started learning that maybe some of their children were born with birth defects because of the kind of work they were doing, and the kind of chemicals, which they didn't even understand what was going on, that were chemicals and pesticides that were being sprayed, or used and whatsoever. And what we started finding out was many, and that happened to me in a way. Uh, when I was pregnant, I only have one child. When I was pregnant, I almost lost my child, my pregnancy. It was my second month, and I was working, and it was not a hard labor that we were doing. Well, harder than what I was used to, but then I learned with time. Not at the time I had the issue of I started bleeding and I didn't know what was going on, and uh, the doctor didn't either, because doctors were not prepared to deal with these kind of issues. Just I was recommended to do certain things. I did, and you know, uh, throughout time, what I went through was guilt. There was a lot of guilt, thinking it was my fault. I didn't want to lose my pregnancy, etc. You go through. Well, imagine these women having all these things that are going in their minds, thinking it's their fault when it's not. Just that conversation is, and then the family, the the rest of the people from the neighborhood, everybody else. If people know that you're not, and even if you are, at fault, but talking about it, it makes a lot of difference. That's it's and the reason why I'm saying this is because it has worked with us in any kind of issue. It has worked with us in terms of gender-based violence, in terms of not blaming the victim, and the same thing, not blaming the mother for having a child with special needs. It wasn't her fault. And when the women started learning that because they were exposed, and I'm talking about, there were like 8, 10 women in a neighborhood, that were working in the same kind of crops, and you would go to other places and the same thing happens, that they were sharing that, and the more they started understanding it, it brings some different thinking. It helps, for them to realize it's not only not their fault, but let's do something, because whomever's causing this, we don't want more children to have this kind of situation. So it's, yes, and I can only say that many people, that many of our campesinas that have had their children, that maybe they're not ¿cómo se llama? Citizens, but their children are, because they were born here. And with time, these children are, the ones that are able to go to school and higher education, Amy being one of them, higher education, are now trying to, represent and trying to push for better regulations and better. But it's about building that not only awareness, consciousness. Consciousness is very important. If you're conscious, it makes you really understand that you have to do something about it. So this has been our thinking ever since we started organizing. That it's we can't wait for others to come and save us. It's about us understanding what are the issues, what are the roots of the problem, and from there take it and work around, not around it, force it
And that's sort
to
of
come out.
the litigation sort of fits into this, Amy, right? Thank you,
Yeah.
Millie.
Uh-huh.
Because you identify the fact that farm workers are among the first in line of exposure to these chemicals. And here you have a regulatory agency that's ignoring that responsibility to protect by virtue of their regulation of those chemicals. So how did you, what was the thinking within the organization in terms of joining litigation like that?
Yeah, so I think, we saw that there was an opportunity to hold the EPA accountable in joining this case. The EPA was mandated by Congress in 1996 to create this endocrine disruptor screening program. Shortly after, a couple years later, they said that they would be releasing their list of chemicals they'd be testing and that they'd initiate screenings. It wasn't until 2007 that people saw that initial rough draft list of the chemicals they'd be testing, and then 2009, the final list. And then fast forward to 2015 was when we first saw the initial screenings that they did, and they had only tested 50 chemicals of over 1,300 that they were going to, and of those 50, only 34 were tested. So we saw inaction for decades, and we saw that they were not upholding the duties that they were supposed to. So we saw it as an opportunity to hold them accountable, especially considering some of the chemicals that were on the list, especially and I'm sorry, I might mispronounce it, cypermethrin and DCPA, right, which were heavily and have been heavily used in states like California on crops like soybean, broccoli, onion, tomato, corn, things that a lot of people in the counties where we specifically know that a lot of women are part of our network, are part of our communities, our family members have reported feeling sick. And some of these specific herbicides mimic estrogen in people's bodies, which can change our reproductive organs. And so while the EPA was inactive in producing a list of what they were going to test, people were coming to us saying, I'm having miscarriages in the field and I'm not getting time off. I'm not able to have any more children. I'm experiencing infertility or fertility struggles. My children are not being diagnosed with a lot of health issues or born with, hearing loss or vision loss, just a wide array of different cancers and conditions that were associated to hormonal imbalances. And so we used our community's powerful stories. We were able to use the research that we had, showing that they were inactive for so many years to, collaborate with several other organizations to hold the EPA accountable. And I think it was, for us to see victory just last month, and that we were able to get deadlines set by the EPA on how they're going to be doing this screening now. We are asking, and we were able to get public update and progress reports, and farm worker communities are going to be able to give input to which new chemicals are going to be screening. And so through the public comment process. So that is something that for us was a win. And we, alternatively are pressuring EPA regularly on separate individual pesticides and herbicides like DCPA, which was recently suspended a couple months ago, which we were involved in as well.
Emergency suspension, yeah.
Yeah, emergency suspension. So yeah, that was one of the motivators, and we're happy to see the progress, and now we're monitoring to see what's going to happen, after January. Right. But we're not going to stay quiet, like Millie said, and we just hope that everyone keeps supporting our petitions for equity and safety.
Yeah. And it shows that.
And I just want to add this, Jay. For us, it's a proof of Farmaco women, representing as plaintiffs and saying, this needs to change this. We need to, make sure that EPA does something. And, there was a response, and now there's a ban. What is it saying? Líderes Campesinas has been involved, Alianza has been involved, the Rural Coalition has been involved, other groups have been involved, but representing the communities. And this is what it's all about. If the communities are not only aware but conscious enough, they will push. They will push. And
well, it's
and
a
this
great
is
story,
very important for us.
and
very
it
important.
shows one angle, that works collectively with other angles, changing
Yes.
regulations, changing policies.
Yes.
I really want to thank you all today. There are many, many more issues we could have gotten to here. I wanted to talk a little about international work. We'll have to do that offline. There's a lot going on in the international arena, which we in the United States often are not as engaged with as we need to be and should be. And I know Les has worked internationally with OECD and other international bodies. But your experience and your leadership has been incredibly important to moving us ahead. Obviously, we have a lot more work to do. We recognize that, but the progress that we can point to enables us to take the next step. And so I appreciate you sharing your time and all your expertise and background with all of us today. So we will continue to try to network and find commonalities among all the various issues that we're working on. Yeah, again, the message today was that we're linked by the fact that we're fighting petrochemicals that are endocrine disruptors. That links us together no matter what campaign we've got going on in our organizations. And we should use that link and find that link because we need to fight together all the existential crises in our generation and the next generation, whether it's health, biodiversity, or climate. So those are the links that bring us together. Thank you so much for today. I look forward to going back, looking at the recording, and thinking of next steps with you guys. So
Thank you so much for inviting.
Yes, well,
and for
pleasure.
being here, listening, all the participants that are here. Thank you.
Thank you for sharing. That's the most important thing.
Thank you.
Okay, have a great afternoon, everybody, evening, and we'll see you down the road. Take care.
Thank you.
Bye-bye.